The first is end-stage renal disease. This is dialysis access. So these patients have AV fistulas and AV grafts that fail, and we have a treatment for that. Second is peripheral artery disease, iliac, renal, femoral, eventually below the knee. There's a third area that's not on this list because it's being used off-label in Europe today, which is the branch of aortic repair. Endovascular aortic repair. So our sales in outside the U.S. are split evenly between those three areas. So we have a platform technology. It is a covered stent, covered with electrospun PTFE, nitinol self-expanding stent. This is the latest generation with the electrospun. It's the PTFE, which is allows for much greater flexibility, radial strength, but also impermeability, meaning the cells do not migrate through that PTFE to cause stenosis. In this category, the restenosis typically happens on the edge, which is called edge restenosis. Dialysis access, if you don't know, is a very challenging patient set. They're very end-stage renal disease, they're very sick. They'll get their grafts placed. Those grafts will fail, whether it's an AV fistula or an AV graft. When they fail, they need to be repaired. Standard of care is balloon angioplasty. That repair lasts about 6 months for 50% of the patients. The other 50% fail. With our technology, the covered stent, Solaris SX, self-expanding, our study shows that at 6 months, 25% fail. So that's a 29 to 30% treatment effect. So covered stents, which the ones in the market today are going to be from Bard, Gore, Merit, and Solaris, they are becoming first-line treatment for the dialysis access patients. We also have an iliac study that shows very high patency rates out to 12 months. Here's where we're going to change this whole environment. I mentioned edge restenosis. We now have, in a phase 2 study with 50 patients out of 120 enrolled, sirolimus-eluting stent, a covered stent. Now, it's not on the PTFE because you don't need it on the PTFE. You need it on the edges, so you don't have to use as much drug, but you want a potent, effective, anti-proliferative drug such as sirolimus to prevent that restenosis on the edges. Our goal is to have the same impact that we had with Cypher when we launched Cypher, the first drug-eluting stent, which was sirolimus. The reintervention rate for coronary bare metal stents was 25-30%. Sirolimus brought that down to 3%. That's the level of impact we want to have here with our drug-eluting program. 50 patients enrolled in a 120-patient phase 2 study. We're bringing both of these technologies to the U.S. in a sequential way. So we'll do the uncoated version first, and then we'll bring the coated version to the FDA for both of those will be PMAs, but certainly we'll leverage each other. As you look at the market, there are a number of endovascular companies that have already been presented here today that are in the space with their wires, balloons, stents, below the knee, peripheral dialysis access, aortic, some are in all of them, some have multiple divisions. There's 2 covered stents today that are older generation legacy, which is the Viabond from Gore, as well as the Covera from BD, from Bard, which is now BD. Merit Medical just got approved for the first electrospun PTFE stent in December, so we're still watching to see how they launch that product. But it's the latest generation. The electrospun PTFE is going to replace the older generation. We're the first follower as a fully electrospun PTFE. We're the only ones that have the capability or are currently working on drug-eluting from a covered stent. We expect about $5 million of OUS sales today. We're in Europe. We're doing very well in Turkey and Brazil. That's about $8 million to $10 million of end-user sales. We have begun enrolling our patients. We've sold over 13,000 of the Solaris SX. That's the base product without the drug. And we've got ongoing clinical studies to date. Dr. Marco Costa is our Chief Scientific and Medical Officer. Marco is an interventional cardiologist. I was the launch leader for Cypher for J&J Cordis back when we did that. Marco was a young researcher who had worked for Patrick Sorois in Netherlands and got his PhD in addition to be a cardiologist, and he's an expert on drug-eluting, and particularly sirolimus. So he's our Chief Scientific and Medical Officer. I'm the CEO. I started my interventional career at Meditech, and then I moved on to J&J, where I had a 13-year career. I worked at Cordis Cardiology, and I built out a team of folks that have had significant experience in taking these technologies to market. You may recognize the scientific advisors, Dr. Peter Schneider, vascular surgeon, and Dr. Ziv Haskell, who was part of the team as an advisor to get the first covered stent approved through the FDA. We're raising a $25 million round. Over the next 3 years, 25, 26, and 27, we expect that we will have about $7 million of contribution margin that will help finance the company, plus a $25 million round. It lets us to do, we're expecting 2 pivotal studies, one for the base program and then one for the drug-eluting. And so those clinical programs are going to be about $20 million. And so this will get us to be able to launch these products in the U.S. if we're not acquired before then. Our timelines and milestones, 2024, we have initiated the drug-eluting phase 2 study. In 2025, we'll secure our first institutional round. This is our only institutional round that we have taken. We've self-financed so far, so it's a very clean cap table. We think with that $25 million, we can get the cash flow positive if we were to launch this ourselves in the U.S. And continue to grow our sales outside the U.S. We will initiate an IDE study for the base platform, the Solaris SX. By the end of the year, we had our pre-sub meeting with the FDA. We've got a little bit of testing to do to put that into the package. We should submit that by September. We'll also have interim analysis in the fall about the same time on the phase 2 study with the drug on it, sirolimus. So that's 60 patients, a half of the 120, with the 6-month endpoint on all the patients. So it's be a very exciting milestones for us in the fourth quarter. We don't believe we'll need a Series B, and then we'll get top-line results and move on to registration and launch of the 2 technologies in the outer years. So in summary, this market is currently about a $2 billion market when you look at the dialysis access, the PAD, and the aortic branching. The effect that Cypher had on the coronary stent that was selling for about $1,200 and then were doubled in price, grew that market. We expect the same implications out in the later years with sirolimus-eluting stent on this market. So we do view this as transformational technology. We're unique from an investment standpoint in that we haven't taken in any institutional money, and we think we can get to the end with just 1 institutional round. And we will be able to put all this together with our experienced team. Thank you very much.